Hello, and thank you for joining us again for Robotic Surgery. So, have you ever been to a movie where you had to wear a 3D, the movie goggles? And you notice that whenever you go to the movies and the object jumps out at you, you become frightened. Well, robotic surgery is not frightening. It is a robot, which is very amazing. My personal experience with robots is that I have been working on robots now for about 13 years. When I first was trained on this robot, I was very intimidated. However, as time went on and I was trained through doctors and surgeons, I became better at what I did. So, on this afternoon, I would like to share with you the advantages of robotic surgery. One of the main points for robotic surgery is the accuracy, the flexibility, the control of hands through our surgeons. I have seen over 1,500 surgeries, and throughout that time, we have had very minimal issues as it pertains to surgery. There are a number of surgeries that we do accomplish or that we do perform at our hospital. One being general surgery, one is for thoracic surgery, as well as ENT surgery and obstetrics. These surgeries can sometimes be very complicated. However, they go very well. When our patients come into the room, we are so welcoming, and most of the time they want to come and they want to experience by seeing our robot. So, why should you receive robotic surgery? Well, for one, in the traditional times, when patients came into surgery, a lot of times their stays were very long. They had over sometimes 5 to 7 days in the hospital. Now, with robotic surgery, you can actually come in and have your surgery that day and leave the same day. So, what is the recuperation time? The recuperation time can sometimes be based on the patient. Let's say you have received a hernia robotic surgery. Sometimes that patient may be out for about 2 weeks, 2 to 3 weeks, and then they can resume their regular activities. However, if the surgery is somewhat complex, the surgeon may suggest a longer time. Also, what are the benefits and risk and complications? Here I have a scholarly article that talks about there are fewer complications such as surgical site infections, there's less pain and less blood, there's a quicker recovery, and smaller, less noticeable scars. So, surgeons who find themselves that use the robotic surgery are most often precise and flexible. This surgery is performed on delicate and complex procedures that may be difficult and impossible to perform otherwise. So, for example, let's say that you're coming in and you're going to receive a robotic hysterectomy. That means that you're going to have your uterus removed. There's so often many vessels that, are somewhat difficult to see. But with this surgery, I'm certain that surgeons are most often to cauterize all of the vessels that are needed. And most of the time, pretty much all of the time, our patients come out with successful experiences. Lastly, will our patients be able to return to his or her activities? I've touched base on this earlier. However, as a personal, I have a personal experience with robotic surgery. I actually was up and moving around within the first day after surgery. So I would like to just put in your minds that robotic surgery is a great thing. And maybe one day, if you have been faced with the opportunity of getting surgery, maybe you can ask, can or will or is robotic surgery an option for me? Thank you.